Good afternoon, everyone. I see that there are still participants signing on, so I'm going to give it just a minute to allow people to sign on. We appreciate everyone joining, so we'll just give it a little bit past 1 here as people are signing on to the webinar. Okay, we are just past 1, and I'm seeing the participants slow down here. But good afternoon, everyone. I want to be respectful of everyone's time who signed on. We are thrilled to have so many participants joining us today from across Indiana and from states all over the country. Thank you for being part of this state and national conversation. I'm Zoe Franz, and I have the honor of being the president and CEO of the Indiana Council of Mental Health Centers. Today's webinar is both a celebration of what's working and a call to continue building this momentum together. This webinar is really for you to understand the impact that Indiana has had over the past year. Couple housekeeping items that I wanted to go over. You are muted, so you can use the chat function. If you have questions, you can use the chat or the Q&A. The webinar slides and evaluation and presentation will be shared. This is being recorded. If you have any questions, please use the question and answer. We are going to wait to the end of this webinar after our panel discussion for those questions to take place. So just know that we will get to those questions at that time. So our agenda today, you will hear from state leaders, justice partners, people with lived experience, and CCBHC leaders doing this work every day. While our examples are rooted in Indiana, the lessons and opportunities are national. So why is that? Our why here at the Indiana Council is to optimize the health and well-being of all people in Indiana through mental health leadership, collaboration, and advocacy. The work of this first year of success and how we got here is this why, and I couldn't be more proud. While we're addressing challenges like access to care, workforce shortages, crisis response, we realize that those are also national challenges. And certified community behavioral health clinics are proving to not only be a solution in Indiana, but also a national solution. So this is our providers. You can see a better version of this map on the Indiana Council's website. I invite all of you to go to the website to see this map. You will see the pretty colors on this map. And what that represents is those who are on the call with me that are part of the demonstration, and then those community mental health centers that the Indiana Council represents that stand ready to be part of certified community behavioral health clinics. So what is certified community behavioral health clinics? You probably have heard that acronym. CCBHCs are federally defined, state-driven, and locally achieved. They combine strong national accountability standards with the flexibility for states and communities to tailor their services and unique needs. Across the country and here in Indiana, CCBHCs are expanding access to care, reducing wait times, and easing the burden on hospitals, emergency departments, and law enforcement. So this is the journey where Indiana started many years ago. We had wait times that were over 8 months at times. We had limited access of services and fragmented supports. Families and providers felt left without rapid options in moments of need. So how this all started has been a journey of advocacy and why we are celebrating today. Through advocacy and through this 1 year of impact, we have seen same-day access and wait times reduced from months to same day. We have advocated for mobile crisis teams to have Medicaid designated teams. We have advocated for CCBHC expansion with the 8 demo sites, and we are ready to have others join. We have also advocated for both state and federal investment and funding for the alignment of 988 certified community behavioral health clinics and crisis stabilization. How this all really started and the landmark of this was Senate Bill 1, a landmark in advocacy. As a lifelong advocate, I never thought we would have the number one priority back in 23. But under the leadership of Senator Kreider, we were able to get Senate Bill 1 to build the infrastructure that we need for our community mental health infrastructure and safety net to be able to provide the much needed services in our community. And today we celebrate that 1 year of demonstration. I'm going to play a video here of Senator Kreider. He is on third reading. And so we spoke yesterday. And so I am going to pull up this video so you can hear directly from Senator Kreider. Good afternoon, Senator Kreider. Thank you so much for joining us on this wonderful 1 year celebration of certified community behavioral health clinics. I'm sorry you can't join us live today, but I really appreciate you meeting with me to be able to share what this journey has meant to you and what your vision is for certified community behavioral health clinics. Could you share that with our audience?
Sure. Good morning, Zoe, and all the participants on this Zoom call. I'm joining you from the caucus room at the Indiana Senate, where tomorrow, as you're hosting this meeting, I'll be in the throes of third reading deadline, which is really a critical time for us to move legislation. So Zoe mentioned a journey, and boy, it's been a journey. I began this discussion really the year I was elected in 2012, 2013, started filing bills that I felt like might help increase access to services in the behavioral health space. And over the years, it kind of became a rhythm for me to meet with professionals like Zoe and Mental Health America and other groups to kind of decide what's the next step. And that led us really to the creation of the Behavioral Health Commission, and the findings of that commission became what was Senate Bill 1 in 2023, which really began to formalize the move to the CCBHC model. I'm not a professional in this space, but I've learned so much from the folks who are, and really we're just absolutely convinced that this is the right model. This is the model that not only delivers service more effectively, but from the policymaking side, guys like me who are looking at budgets and appropriation, the amount of data that the CCBHC model produces really validates the model. And I'm just so pleased with the 8 pilot projects that we've had now have become the CCBHC platform for Indiana. Looking forward to opportunities to expand that. And then next year, when we have a budget session, we'll be looking at other funding models. But the initial data is so positive. And ultimately, for me, my goal is that for the folks in Indiana that find themselves in the position where they need services, that they'll be able to find those quickly and receive those services in a manner that really we haven't seen, I think, even nationwide until this model began to come along. And so we've been having this interesting discussion here in the state, and I've got a number of bills again this session, kind of the hard topics like SRIN services programs. I just passed that bill yesterday, and the amount of debate that comes along with that. There's still, as you folks are aware, there's quite a bit of stigma around mental health and addiction issues. And today we're going to have an interesting discussion about homelessness. And I just visited one of the community mental health centers, CCBHC model, on the south side of Indianapolis recently. And one of the things that jumped out to me was their outreach efforts and what they're doing along with Indianapolis Police Department to go out and reach out to these folks and try to make sure that they're providing an appropriate level of care. And so we have a bill that I'll be voting against today because it adds penalties, which I think are counterproductive to the direction we're really trying to go. And so, I look back on the last 14 years, and I'm just kind of amazed at both the amount that I've learned, but just the passion from the people that are involved in this space, their dedication to the public and providing the care that the public deserves and needs. And so I'm looking forward to next steps. I know some of the folks on this Zoom call, are maybe in the initial steps of exploring this model. And I'm proud to have Indiana as an example that you can look to. And I think you're going to find that the model, every place it's been tried, is the direction we should continue to try to go. I said from the beginning, if this isn't it, then let's keep working until we find it, right? Because ultimately, the desire is that we'll serve the population that we represent in a manner that, they don't end up in really dire straits. And my experience early on was that happened too often. And so I'm grateful for you folks taking the time to get together and talk about these issues. As you move down this path, if you have legislators in the state that you represent that have questions, feel free to have them reach out to me. I think I'm probably considered the mental health expert for Indiana. I'm not an expert, but certainly from a legislative process, I've been very successful at moving these issues forward. And so everything from 988 to CCBHC, we've done the bills, and I typically have carried those, and I'm happy to be a resource for your state as you continue this conversation. God bless you all. I hope your day goes great. It's good to be with you this morning. Great to see Zoe and all the other folks' smiling faces. I hope you have a great day. I'm happy to talk to anybody that has questions if you do later on. Thank you, Zoe. Good to see you, folks.
Yeah, thank you. Thank you, Senator Kreider, and thank you for your continued advocacy. I'm surprised you didn't wear your cape today, because remember, you are forever my mental health hero. So thank you for improving the access for those that we serve, and for knowing that this is a model that makes not only things sustainable for those we serve, but for providers and also for the state and federally. So it's a win-win in every direction, and we really appreciate the championships and the leadership that you have offered. So could not be more grateful. We appreciate you.
It's been my honor. Thank you.
How wonderful to have such a champion and leader in Senator Kreider and his vision on certified community behavioral health clinics. Not only is it happening here in the state of Indiana, but the national impact today of certified community behavioral health clinics operate in 48 states, territories, and serve more than 3 million people. They reduce hospitalizations, support housing stability, and strengthen community-based crisis response. One of the greatest things we've seen in Indiana with this work is our work with law enforcement. I'm now going to turn it over to Sheriff Robinson to share the impact that he has seen in his community with certified community behavioral health clinics. Thank you so much, Sheriff, for joining us.
Thank you, Zoe. Can everybody hear me okay?
Yes, we can, sir.
I'll go ahead and get right to it. I wanted to take a few minutes today, maybe about 10 minutes, I suppose, to talk about two initiatives in Vandenberg County, the Crisis Response Team and the Jail-Based Competency Restoration Program. And both these work together to change the way we respond to the mental health needs in our justice system. And more importantly, why neither of these programs would be as effective without the Certified Community Behavioral Health Clinic model, or CCBHC. Like many communities, Vandenberg County faced two closely related challenges. First, we saw individuals in mental health crisis cycling repeatedly through the emergency rooms and into our jail. These were not people who primarily needed punishment. They were people who needed timely behavioral health intervention, but were often encountered by law enforcement as the first and only response. So second, we had individuals who were found to be incompetent to stand trial, sitting in our jail for extended periods of time. They were waiting for placement in state hospitals, sometimes for months. And during that time, their mental health frequently deteriorated. Instead of stabilizing, they became more disconnected, more distressed, and harder to treat. Both of these problems pointed to the same underlying issue. We were trying to solve a behavioral health challenge with a system that was not designed for it. And so in 2023, we began using the crisis response team through our partnership with Southwestern Behavioral Healthcare. Shout out Katie Adams. This team responds in real time to individuals experiencing behavioral health crisis, often before a situation escalates into an arrest or a use of force. And so what makes this effective is not just the response itself, it's the fact that the team is anchored in a CCBHC provider. This means that when someone is encountered in crisis, there is an immediate access to care, follow-up services, and continuity beyond that first encounter. It's not a one-time interaction, it's a doorway to treatment. And I'd like to share with you a brief example of what that looks like in practice by way of a real-world example. One of my deputies was dispatched to a local business for a welfare check involving a woman who appeared anxious and was possibly impaired. She had made concerning statements to 911 about a firearm. And when the deputy arrived, it quickly became clear this was not a criminal situation. This was a person in crisis. She was homeless, she was traveling alone, and she was fearful for her safety, and she was struggling with her mental health. She voluntarily surrendered her firearm because, in her own words, she no longer felt safe having a gun. She was not violent, she was not threatening others, and she was just scared, asking for help. So instead of defaulting to an arrest or other form of escalation, the deputy contacted the crisis response team, and a clinician responded to the scene, spoke to her, and helped de-escalate the situation. Now, one of her biggest concerns was not being separated from her dog. That was the only sense of stability she had. So working together, the deputy and the crisis team located an animal rescue and found temporary solutions so the dog would be cared for. With that barrier removed, she agreed to go with the crisis team and receive services, shelter, and ongoing care. So no one was arrested, no one was hurt, and a potentially dangerous situation was resolved calmly, safely, and compassionately. And a person in crisis was connected to help instead of handcuffs. That's the crisis response team at work. This team has fundamentally changed how we operate on the front end. Deputies are no longer the sole responders to mental health crises. Instead, we pair with public safety and clinical expertise. This has resulted in fewer unnecessary arrests, fewer emergency detentions, and better outcomes for individuals who might otherwise have entered the justice system simply because no better option existed at the moment. On the back end of this system, the jail-based competency restoration program addresses the same population, but from a different angle. These individuals are found incompetent to stand trial. Treatment now begins on site rather than waiting months for a state hospital bed. Qualified behavioral health professionals provide structured competency restoration services inside the jail, allowing individuals to stabilize and progress more quickly. I'd like to share another real-life example that demonstrates the success of this program. We had a 28-year-old man with multiple mental health diagnoses, including bipolar disorder, schizophrenia, and paranoia, and this individual was in our jail. He had no consistent treatment history, and he had not been compliant with his medication. So over a 2-year period, he was arrested 5 different times. Those arrests included everything from trespass to resisting law enforcement to battery on law enforcement and making threats. All of these incidences stem from shoplifting or theft charges driven by untreated mental illness. Inside the jail, there were more than 30 incident reports. These included suicidal ideation, sexual misconduct, threats against staff and inmates, repeated noncompliance with jail rules. He could not function in a general population environment. He had to be housed in single cell segregation. Not ideal for someone suffering from mental illness. Well, Over a 3-month period, while still incarcerated, he was placed into our competency restoration program. He began receiving counseling, peer support, medication management, and therapy. Over those 3 months, the change was dramatic. Behavioral and noncompliance reports decreased significantly. He was able to move from segregation back in the general population. He became more stable, more cooperative, and more engaged. Following his release, he continued treatment at the Evansville State Hospital. He successfully completed competency restoration, and his criminal case was ultimately dismissed. Today, he remains active in treatment with local providers, and he holds a steady employment and has permanent housing on his own. Now, that outcome was not an accident. It happened because treatment started when it was needed, not months later. And it happened because the program was connected to our broader system of care. So once again, the CCBHC model is critical. These services are not a standalone jail program. They're part of a comprehensive behavioral health ecosystem. Treatment is coordinated. It's evidence-based and connected to care that continues critically after release. This reduces delays. It improves restoration timelines, and it allows cases to move forward appropriately through the courts instead of stagnating in the jail while the person awaits to have their competency restored. From an operational standpoint, both programs have improved safety inside our facility as well as out in the community. Individuals actively engaged in treatment are more stable. They require fewer crisis interventions, and they place less strain on correctional staff and emergency resources. And from a fiscal standpoint, these programs reduce costly hospital transportations and extended jail stays and hospital placement. But the most important impact is human. These programs reflect a shift away from using the jail as a default mental health holding facility. Instead, we are intervening earlier through crisis response. We are treating individuals appropriately when they enter our custody, and we're doing so in a way that respects due process, dignity, and public safety. The common thread here is the CCBHC model. It allows us to move quickly. It lets us coordinate care, and it prevents the gaps that have historically caused people to fall through the cracks. Without that framework, these programs will be fragmented and far less effective. Together, the crisis response team and the jail-based competency restoration program represent a more humane, a more efficient, and responsible approach to health care and justice. They work because they are integrated. They work because they are clinically grounded, and they work because they are supported by a system designed for access, continuity, and accountability. And it's not just about changing programs. It's about changing outcomes. It's about changing lives. And it's about building a system that recognizes that public safety and behavioral health are not separate goals. They're deeply connected. I want to thank the Indiana Council of Community Mental Health Centers for allowing me to speak today. And I want to thank you, Katie Adams, and your amazing staff at Southwestern Behavioral Health Care. I remain in your debt. Thank you.
Wow, Sheriff, let me take a moment to pull myself together with tears here and everything that you shared. Thank you so much for your leadership. Thank you for sharing those comments. Thank you for sharing. Not only is it transformational, but it really is humane to be able to meet people where they're at. And through your work with Southwestern, I really am grateful for that. Thank you so much.
Wow. Thank you.
So now we are going to share a client story and a client journey. And so Miss Denisha Duncan, can you join us here? She is going to share her journey. She comes from Eskenazi Health, who is also in the demonstration, and she is going to share her journey of how she has had lived experience and is now doing work at one of our certified community behavioral health clinics. I'm going to turn it over to you. Thank you so much for being here.
Thank you for having me. Good afternoon, everyone. I just am so honored to be able to speak and share my story. That was amazing what the sheriff said. I'm getting myself together as well. I just wanted to dive right into my story. At the age of 22, I experienced psychosis. Now, at the time, I did not know it was psychosis. I was going into my shift at a pharmacy. I was a pharmacy production clerk, and I was on the pharmacy floor experiencing paranoia. Um, I was terrified. I didn't know what was going on in my mind, but I could tell that something was wrong. I told my significant other at the time to take me somewhere, anywhere, and I ended up at Eskenazi's triage. Um, I ended up there and started receiving treatment almost instantly down the hall at Park Prevention and Recovery Center for Early Psychosis. I started receiving treatment there, and I am so grateful for Prevention and Recovery Center for Early Psychosis, because had it not been for them, I don't know where I would have ended up, how I would have gotten the treatment or anything like that. Which is Park, the Prevention and Recovery Center for Early Psychosis. They are one of CCBHC's certified community behavioral health clinics, and I ended up receiving treatment there. I had a care coordinator. I had a therapist, a doctor, and received, med management. I'm completely grateful just for my experience there, going in being so terrified, not knowing what was going on in my mind, and my mind racing, that I have not experienced psychosis since 2017. I am just blessed, to have been able to go to a prevention and recovery center for early psychosis. And when I was experiencing psychosis, it was definitely just terrifying, and honestly traumatizing. I was just hoping and praying that I would feel better. So I definitely thank Park, the Prevention and Recovery Center for Early Psychosis, and Eskenazi, period. I thank them because I honestly don't know where I'd be without their help and without their care coordination and med management and other things like that. So kind of fast forward to now, I actually work in triage, where basically if a client is in a mental health crisis or addictions crisis, where they come to seek help, seek treatment, or seek talking to a doctor, talking to a clinician, they can come there and also talk to a peer, because I sit alongside two nurses every shift, and I can share my story, which is so fulfilling. Literally can point to the room I was in, for a client to understand there is someone that has been there too. Actually, just a couple of days ago, the client was actually in the room I was in. So it's full circle moment, where I can share my story and actually help someone and instill hope, which is what CCBHC brings, this peer support. And it's able to help people. It's able to give hope, able to, restore families and help, because not only can you be peer support to a client, but to their families. And it's very elite that the CCBHC allows the Park Clinic, Prevention and Recovery Center, to have peer support. So I just also wanted to say CCBHC can only help. I don't think it can hurt. So I just think it's the most amazing thing. And, um, back when I was experiencing psychosis, maybe it wasn't around. Maybe I would have, you know, been more appreciative to have a peer, like I have myself, someone who understands, someone who went through the same thing as me. But now I'm able to give that to someone else. And it's just a beautiful thing. Try not to cry here. It's great. I hope I was able to touch on a lot of things. Just wanted to speak from the heart and just wanted to share my story. I'm so grateful to the Indiana Council. Thank you, Zoe, for everything that you've done thus far.
Absolutely. And really, the thanks goes to you. Thank you for your bravery. Thank you for standing up and sharing that story. I am so honored to be able to work with you on this celebration and so thankful for Eskenazi and the work that they have done and that you're now part of this amazing transformation, right? Just let's all take a moment and just take a moment to think that this beautiful woman started with a need and she went to get that need helped through that crisis situation. And then through that care, she is now helping others, thousands of people now through this work. And so let's just take a moment to recognize that you are what this is all about. So thank you again for being on and for sharing your story. And you can see all the thanks
Thank
in the
you.
chat. You can see
Thank you,
all the thanks in
everyone.
the chat and people raising hands and celebrating. So yes, let's take a look at that as we transition now to our panel discussion of our 8 demo sites as they come on. And their beautiful faces added to this conversation. Awesome. So this is our panel today of our 8 demo sites. And so we have a couple questions that we prepared for this panel for them to share. So just to recap, you heard about the vision and the policy advocacy. You heard from Senator Kreider about the vision legislatively here in the state. You heard from Sheriff Robinson about the impact that it's had in jails. And you have heard from Denisha about her clients, her impact, her personal journey. Now you're going to hear from the providers who stepped up and said, yes, we are going to be the 8 in this demonstration, and we are celebrating the 1 year of impact with all of them. So the first question that I would like to ask goes to Hamilton Center. We've seen the past year the impact, and we just heard this client story. Art, can you share with us what other impact you've seen on those that we serve?
Yes, absolutely. And again, just want to first thank Mrs. Duncan and Sheriff Robinson just for some wonderful, just setting the stage. We have a phrase at Hamilton Center where we say CCBHC is here to save lives. And the stories that we just heard here today just really prove that. And here at Hamilton Center, the first story I want to share with you is dealing with somebody from one of our most vulnerable populations, that being the unhoused. And so over an 11-day period, imagine this, our crisis team, which definitely includes these wonderful people called peers, they were able to create a connection with this person who did not have a place to stay and was able to communicate and allow the person to decide for themselves that, hey, transitional housing may be a great option for me at this time while I'm going through crisis. And they were also going through active substance use at the same time. And then here's where we hear more about the power of these peers. So like within our team, our peer was able to make the connection with this unhoused individual that had now made the decision to go to transitional living. And over the course of 11 days, just think about that, 11 days, our peer working in the Crisis Diversion Center, our team made up of crisis diversion specialists, therapists, providers, they were able to get this individual from being unhoused to actually in a transitional living situation with full-time employment within the scope of 11 days. So this is an example of just the success stories that we're seeing here at Hamilton Center. And I think one of the most powerful things from this individual, this is kind of like a direct quote. The person said, I kept hearing the peer support specialist voice in the back of my head with positive and encouraging words. So not only is CCBHC making this systemic impact, it's really providing the safety net and making a real connection for people to make the decisions that they need to make their lives better. So that's one example. And then I wanted to share one more, which deals with a person that was actually just recently released from incarceration, which we know can be a very vulnerable time. And so one of the advantages that we were able to show is after this person who was originally in our inpatient unit, after they were discharged, our team was able to follow up and support them so that over time, this individual, they became more stable. And so when they actually started to recognize that some of the symptoms within inside of them, where they normally would not know who to reach out to, they reached out to our team at the Crisis Diversion Center, and we were able to provide that support. So we could definitely just go on and on, but I think the thing that I just definitely want to emphasize, I mean, this CCBHC is here to provide that safe space for people at their lowest moments where they can develop trust, they can stabilize, and we can help them towards the best next steps for where they are right then and right there. And that's what we're doing every day here at Hamilton Center. And I'm certain that that's what our other demonstration sites are doing as well. So just wanted to share that with everyone.
Wonderful, Art. Thank you so much for sharing that. And thank you for sharing that impact. The other impact that we've seen statewide has been around workforce. We have seen our turnover go down, our retention rates improve really systematically amongst the demo sites. And so I wanted to have Dr. Carrie Cadwell from 4C share what they have seen with workforce.
Thanks, Zoe. I really appreciate it. Hi, Carrie Cadwell. I'm the CEO of 4C Health. We are serving 7 CCBHC counties in north central Indiana. So when we think about CCBHC as an operating system, having to elevate and advance accessibility, convenience of care, quality of care, and then a part of that model is wrapping care around a community, right? Not just the individual, but a community and a county. In order to do those things, you have to have the workforce. And if you've worked long enough in behavioral health, you know that that is oftentimes few and far between. So the question really in front of us when you move to a CCBHC operating system is, does that CCBHC operating system produce workforce development and sustainability that exceeds the capabilities of the existing community mental health system operating system? And what I would tell you from our experience to date and what our data shows is that that is absolutely the case. So over our first year in the demonstration, and including just a few months ahead of that, we onboarded over 116 individuals into the 4C Health workforce in our rural area. And I'm going to keep coming back to this, our rural area. And that was amazing. And even more amazing is the fact that that was coupled with a over 45% reduction in turnover. So we're talking about people who are coming to work for us, that are staying with us. And these are really critical positions. So we saw an over 100% growth rate in our therapist positions. We started out with 21 therapists in our rural 7-county area, and we are now up to 46, and we are on our way to 50. Speaking of peers, I think there is nothing better in CCBHC than the ability to provide recovery, live recovery, and then ultimately in your work, give recovery. And so our peer workforce started out at 10, and now we are at 26, headed for 30 with a goal of 50. And that's all attainable in this CCBHC operating model. When you add more workforce, you can train more people. So you can become a force for furthering that development of workforce. So in our first year as a demonstration site, we trained 43 individuals, of which 23 of those individuals were master's students. Those are 23 people that are on their way to becoming therapists in the state of Indiana. So that volume will continue to increase. We have a goal of serving 50 or providing 50 of those types of internships and practicums. Again, when you can build the workforce, you can sustain the workforce, you can create accessibility, convenience, quality, and you can wrap care around communities in ways that, frankly, the CMHC operating system cannot and will not be capable of, right? That's why we have to advance. So this has been unbelievable in the area of workforce development. And I will simply say this, that when you are talking about improving the health of individuals living in Indiana, and particularly given that we are pretty much a rural community, when you're talking a rural state, when you're talking about improving the health and well-being of rural communities, you can provide the direct care. That's what this model is. We're here to provide the direct care to individuals, families, groups of individuals. But the reality is health and well-being is not simply a matter of getting the care you need. It is also for rural communities about feeling like there is something that creates some stability, opportunity, and hope for you to live and be viable in that rural community. The place where if you are rural, you know how much you can be passionate and love your rural community. And so not only is CCBHC giving care and creating wellness in that way, but it is also via our workforce development, creating opportunity, wellness, economic stability, and furthering the ability for viability for people who are passionate and want to live their life in our rural communities here in Indiana. And so I can't echo enough what everybody else has said, but for us, everything starts and ends with the ability to develop the workforce to care for our communities. And this has really been a game changer for us.
Wonderful, Carrie. Thank you so much, Dr. Cadwell, for sharing that and being such a leader in our rural communities around workforce. The other center who has seen such an impact in the demonstration around workforce is Centerstone. Rob, would you like to share what impact you guys have seen over this past year?
Absolutely. Thank you, Zoe. And thank you, Dr. Cadwell, because I think our workforce story at Centerstone is pretty similar. We're covering 15 counties under the CCBHC pilot. And in that, we created 3 regional hubs. And really the desire was to improve accessibility to those services as well as shorten the wait time for the services. And even prior to that, while we've been making progress to our access times and getting into care, CCBHC really enabled us to increase the number of people we see same day you walk in, as well as more than cut in half the time it took to get to that next appointment. And really that was through increasing workforce numbers. After the first full year under the model, we saw a 35% increase in staffing across those 15 counties. About 90% of those are client-facing clinical positions, which has been tremendous. Most of that impact and growth was in our adult service area, where that additional staffing support enabled us to see 27% more people in that year. As well as additional staff dedicated to just accessing care. Other areas of significant increases were in our crisis service area, as well as child services, providing those critical services in schools. And also to Carrie's point, one of the most encouraging parts of the growth is where we are seeing it. Usually in our larger communities, that's where we have more success in hiring. And over the last year, we've seen as much or more growth in our more rural counties surrounding those communities. And while we hope that trend continues and we desire that to continue, we also know there are limits to that, to supply of certain types of staff like therapists, which kind of leads me to the next point. Prior to CCBHC, I'm speaking generally, we were more likely to hire new graduates coming out into the field with their master's degrees. They would get their supervision to get full licensure, and then they would typically look for other opportunities, better paying positions, larger health systems, go into private practice, or even with an MCE. Back in 2024, prior to our real push to recruit and hire more licensed therapists and master's level clinicians, we would struggle to maintain those staffing levels. And on some level, it would just kind of churn. But through the support of CCBHC, we've seen a 43% increase in those FTEs and with the hope of adding more over time. And not only does it improve our ability to increase that, to meet the increased demands for access, but it also supports our increased clinical supervision efforts, which we know are key for that staff retention and, most importantly, the quality of care. Another area to highlight among many, we've seen a significant positive impact just within our expansion of our crisis services continuum. Using grants as well as CCBHC support, we've been able to open 3 crisis stabilization centers, or STRIDE centers, and along with our mobile crisis teams, we've been able to hire additional staff, of which includes 23 peers, to provide that 24/7 availability for care and response to a growing number of crisis calls. So without CCBHC, it would not be possible or sustainable. So appreciate the time, and we really do just recognize we're at the beginning of so many positive impacts with CCBHC.
Yes, thank you. At the beginning, 1 year, let's remind ourselves, 1 year of impact. Let's think if this is a model that can be owned in the state and federally, what transformation that will take place for our workforce. So now I wanted to go back to about community impact, and I wanted for Katie at Southwestern to share the community impact they have seen. And one thing I wanted to note, we have Southwestern and some of the names of the demos say where they're located. Our demos, you can see on our provider map, we are east to west, north to south. There is 8, but we do have several others that are standing ready to be part of the demonstration. Katie, I'm going to turn it over to you for the community impact.
Thank you, Zoe. And I want to thank Sheriff Robinson, who did a great job talking about our community impact down here in Evansville. So I'm with Southwestern Behavioral Healthcare, which is the southwestern corner of the state. So Evansville is the major city here, although we do have some rural counties around us. You know, when I think about community impact, what I think most of immediately is the impact on our law enforcement partners, as Sheriff Robinson talked about, as well as hospitals. A unique part of the CCBHC model is that it allows for the creation of a crisis continuum, which not only includes somebody to call, but also somebody to respond and somewhere to go. In 2022, we had a total of 435 crisis contacts. So that was just 3 years ago. As we built the foundation of CCBHC and the crisis continuum, this has grown to 6,707 crisis contacts last calendar year, 2025. So this is a service for everyone in the community, not just individuals that are currently in treatment with us. 6,700 crisis contacts. Of those contacts, 632 of them were mobile crisis team responses in the community. So this model allows for people with lived experience and crisis professionals to meet individuals in crisis where they are to assess safety and address immediate needs. Prior to CCBHC, 911 was called, law enforcement was called, which led to limited options and often undesirable outcomes for those in crisis. So with the mobile crisis team intervention, this past calendar year, 67% of those contacts resulted in the individual remaining in the community with regular contacts with our team to follow up with whatever their needs are through that crisis. About 30% of those connections in the community resulted in our staff facilitating hospitalization, which was the level of care that was needed at that time. Only 3% of our mobile crisis team responses resulted in law enforcement intervention to resolve the crisis. 3%. So people are getting the care they need when they need it with desirable outcomes. CCBHC has also expanded our capacity for following up with individuals after psychiatric hospitalization. In January 2025, our team successfully connected with 56% of individuals the day after being charged from a psychiatric inpatient stay. This improved to 83% of successful next day contacts after hospitalization by the end of the calendar year. So we started with 56% contacts and completed our calendar year with 83%. And this is because of the CCBHC infrastructure. And you can imagine how important that is for somebody who's being discharged from a hospital due to a psychiatric crisis to get that immediate follow-up. Of those that we connected with next day, 92% of them attended their first appointment with a provider within 7 days of hospital discharge. So ensuring this continuity of care after hospital discharge is essential to ensure successful transition back to the community from a psychiatric crisis. And that is just a few data points to show community impact. And I know that there are many more stories that we're going to be hearing during the celebration. Thanks, Zoe.
Thank you, Katie, and very compelling data there that you shared. Thank you so much for sharing that down and the great work you and the sheriff have done down in the southwestern part of the state. The other demonstration, adult and child, Dr. Christine Nigadank is going to share about the community impact that they have seen through this 1-year demonstration. Christine?
Yeah, thank you, Zoe, and good afternoon to everyone attending the webinar today. I am Christine Negendank. I'm the President and Chief Medical Officer at Adult and Child Health. We are in Marion and Johnson counties, and so based out of Indianapolis. So the community impact of the CCBHC model truly cannot be overstated. From my perspective as a community-based and forensic psychiatrist with more than 25 years now of clinical practice, the implementation of the CCBHC model represents the most significant and transformative advancement in care delivery that I have witnessed in my career. So I believe the greatest impact of the CCBHC model on our community is the no wrong door approach. So this provides universal access to care without the barriers that we've seen in other models. So individuals can seamlessly access integrated whole person care at any entry point. So this includes inpatient units, emergency rooms, shelters, crisis centers, the VA system, primary care, the correctional system, and on and on. And this eliminates the need for clients to navigate fragmented systems and allows individuals to receive care when and where they need it without falling through the cracks, which we have all seen time and time again when providing treatment through prior models of care. So some examples of how CCBHC has been able to help us at Adult and Child create that no wrong door approach is that we've been able to expand our military services. So we have hired a veterans coordinator to build relationships with the VA system and other veterans organizations and have developed a dedicated care coordination referral process for veterans. We've also been able to train all of our staff at Adult and Child to better understand the unique needs, right, of providing care for veterans. And because of these efforts, we have seen an 82% increase in the number of veterans served and a 460% increase in the number of services provided to veterans within our agency. We have also been able to expand our workforce to reflect the top languages that we identified in our community needs assessment and now offer services in our clients' primary languages. So these efforts have reduced those access barriers and have expanded language access in multiple ways. So in intakes, in screenings, in peer services, and in therapy. And we've been able to launch an intensive outpatient program in the Hakka Chin language to better serve the Burmese community. Furthermore, we have developed and implemented a client and family advisory council to assure that our initiatives for the community are truly making the impact that we believe them to be. So this council is a formal group of clients and family members and organizational representatives who collaborate to improve the services that we provide in our agency. And members of this council help us by providing insight and feedback and guidance on our programs, our policies, and our practices to make sure that our services are client and family centered. So collectively, these and other efforts have broadened access to care for our communities by creating those multiple entry points to treatment and delivering services in the places and the moments that individuals need them most.
Wow, what a community impact. And thank you for the work you've done in the veteran space and with military, and also living down in that area once upon a time, knowing the Burmese population and having an intentional focus on that. Thank you for that impact. We stressed earlier the importance of what access to care was before CCBHC, and now under the demonstration, what we're seeing as far as the changes that have been made. I'm going to turn it over to Radiant, to their new CEO, Stacy. I think this might be your first large webinar for Stacy to share that impact in access that they have seen. Stacy?
Sure, thanks, Zoe. For Radiant, CCBHC has really been transformative as it relates to access to care. So before the CCBHC model, individuals who were seeking care, when they called to make an appointment, it on average was about 6 weeks for an individual to get in and start treatment. Under CCBHC, we have been able to transform that, and now the average wait time for a first day or first appointment is under 2 hours. So we've created that same day access to care where people get the care when they need, exactly how they need it. So we serve Grant and Blackford County, so we're a relatively small CCBHC. In 2025, we have served over 1,000 individuals that came in and were able to be served under that same day care model. So making a huge impact in our community. Also through CCBHC, as you've already heard about it from other speakers, we have our mobile response team and our stabilization service. Those are also points of access to care for us and to get individuals started. And through that process, we're able to follow up and make sure not only in the crisis and following the crisis, but we're able to truly attach those folks to ongoing care that they need. A data point that we find really important around access to care is through our stabilization unit. Radiant has a stabilization unit that serves all ages, both youth and adult. I think the part that surprised us is when we launched the stabilization service, we knew we would see youth and families. But in 2025, approximately 40% of those contacts in that stabilization service has been youth and families. So clearly a real need for both youth, families, and adults. So through that access, we're able to ensure people get the care they need before situations escalate, as you heard from other speakers, where law enforcement is involved or an unnecessary ER visit occurs. So for Radiant, that access has been critical for our communities to get people in timely.
Stacy, that's absolutely wonderful. And I just have to say that I have been to your crisis unit and it is absolutely beautiful in the work that you have done. And I think my dog agrees. If you can hear that in the background, of course you can't time that, but he's cheering that on. So Kelly, I know up at Oaklawn, you guys have also seen quite a bit of access to care improvement. Can you share about the things that you guys have seen up in South Bend and the surrounding areas?
Yeah, happy to. Thanks, Zoe. Gosh, it's been great to be a part of this call and hear all of the wonderful things that everyone's done, and I'm happy to share. We are in northern Indiana serving Elkhart and St. Joseph County. And as I've been reflecting on this in 1 year of being a CCBHC, I think there's two sort of distinct points of change, right? One is the what of what we did, the programs we added, the staff we added. And then I think there's this other piece of the transformation. I think we've all used that word of who we have become while we've done this work. And I want to touch on the transformation piece before we get to the what we've done, because I think it's been profound for us, and it's truly one of the hallmarks of being a CCBHC. First, we have seen a dramatic shift in how we view our responsibility to our community. And this is especially in the area of accessibility. It's never anymore a question of, are they our client when something's going on? It's they live in our community, and our community is our responsibility. Along with that, we've changed our expectations and our response based on the clear expectations and benchmarks around accessibility set by the CCBHC framework. And we've enhanced our ability to meet those expectations by learning new best practices, collaborations and learnings from everyone else on this call, and then access to the technical assistance that we've received. A second transformation has happened with our community and partners, as this has really challenged their expectations of what mental health care can and should be. Those transformations have occurred, I think, in large part due to the changes we've made related to accessibility. And we've made changes in three key areas. First, as Stacy mentioned, and we've collaborated and learned from them, we have an open access model where individuals can walk in 5 days a week to any of our 3 campuses to be seen. We can connect them immediately to crisis care if the urge is needed, or if the need is urgent. If they want to get into ongoing services, we have them meet with a therapist who can complete a full assessment, understand what's going on, and make recommendations for ongoing care. This model has allowed us to meet the needs of our community in a much more urgent and comprehensive way. In the first 6 months of having a same-day access model, we saw the same number of individuals as we had the previous year. 94% of people leaving our open access process report feeling heard and respected. The second part of our increased accessibility is related to our expansions of our community-focused teams and our crisis services. I think you've heard sort of that motto of when and where the need is from everyone who's spoken today, and that certainly is true for us. To have teams that work in the community, are available 24/7, 365, means that we can reach a broader group of individuals who may not be able to come in to our centers, or who may be in treatment and may need just some additional support as to support their treatment and the care that they're already receiving. The third change related to accessibility is the addition of care coordinators. And I think some others have talked about this as well. We've added individuals whose entire role is to support some of our most vulnerable clients to get into care, to stay connected to care, to connect them to needed resources, to follow up and check in and make sure that there's no barriers for them to engage in treatment.
Thank you, Kelly, for sharing that impact on access and the great work that you guys are doing up in the northern part of our state. I wanted to also highlight community partnerships. You've seen some of this on the call today, but there are quite a bit of community partnerships and relationships that have improved, whether it be a county commissioner, whether it be a sheriff, whoever that might be, our local emergency room. And so I wanted to ask Adult and Child, Dr. Christine, if you could share a little bit more about the community partnerships that you guys have seen.
Yeah, sure. So that no wrong door approach that I mentioned earlier is only possible through strong community partnerships, which is something the CCBHC model has allowed us to significantly expand. So, for example, we have built and sustained strong relationships with law enforcement and problem-solving courts, allowing us to work closely with justice-involved individuals to help break the revolving door cycle within our correctional system. And through these partnerships, we are also able to respond directly to court-identified crisis needs. So really providing that care at the moments it is most essential. We've been able to strengthen other partnerships, such as our partnerships with organizations serving individuals experiencing homelessness. And this has included embedding therapists and peers at Wheeler Women's and Children's Shelter, really creating that direct link to behavioral health services, but also a seamless connection to psychiatry and primary care and addiction services within our agency. Our youth-focused partnerships have grown as well. So this has included collaborations with Boys and Girls Club and Excel Center and school-based programs. And we have been able to implement innovative approaches to deliver behavioral health services in the community, in community settings serving at-risk youth. So this would be alternative education programs and after-school programs and youth services within homeless shelters. And we all know that by embedding care in familiar and trusted environments, we improve access, promote early intervention, and support the continuity of care. And then an extension of this work includes partnerships with agencies serving justice-involved youth, helping divert young individuals from legal involvement whenever possible. So while there's many more partnerships I could highlight if given all day, but I believe these examples really reflect the meaningful community development initiatives really made possible through the CCBHC model.
Thank you. Thank you so much for sharing that. And before, Katie, we go on with the partnerships, one thing that I wanted Dr. Overly to hit at Eskenazi, because I think it's a really important connection of crisis services and certified community behavioral health clinics, and how we built Senate Bill 1 and how we built this in the demonstration. And Eskenazi has done a great job in doing that together. So Dr. Overly, could you share your comments regarding crisis and CCBHC?
Yeah, sure thing. Thank you, Zoe. So I'm Ashley Overly. I'm the CEO for Sandra Eskenazi Mental Health Center. We are the mental health division of Eskenazi Health, and we serve Marion County. Sandra Eskenazi Mental Health Center was actually the first community mental health center in the state of Indiana, and we are very proud to now be part of the first cohort of certified community behavioral health clinics in the state as well. I do want to highlight that I think crisis really is one of the most distinct features of CCBHC that sets it apart from the CMHC model of care. So CCBHC defines and supports resources for crisis that did not exist under the CMHC system. So the Federal Substance Abuse and Mental Health Services Agency has defined crisis guidelines that really outline a pretty straightforward approach to meeting mental health crisis needs. So per SAMHSA, an adequate mental health crisis system requires 3 pillars. So first is someone to call, second is someone to respond, and then thirdly is somewhere to go. And so those 3 pillars are just an adequate crisis system. And so it's really important to note that crisis really can't succeed as a standalone service. Without a functional system of ongoing outpatient care, crisis services just become a bridge to nowhere. So creating mobile crisis teams without developing CCBHC would be like hiring ambulances without building a hospital, or building a hospital without having an outpatient clinic to follow up with. And so CCBHC defines and provides the infrastructure to make sure that that complete spectrum of services is available. 988 was introduced nationwide as a nationwide mental health crisis number in July of 2022, and that's the first pillar of our continuum. And so it's CCBHC that then provides the next 2 pillars of the crisis system that we need to have the fully functioning crisis system. So CCBHC defines and supports mobile crisis teams, that's someone to respond, and it also defines and supports the outpatient crisis response. The crisis receiving and stabilization services, that's somewhere to go. So this is what helps reduce costs to emergency departments and criminal justice response and provides a more appropriate level of care for mental health crises. And Sheriff Robinson, I think, did a great job of highlighting the value of those crisis services and how those interact with criminal justice services. CCBHC defines also requirements for care coordination with crisis and outpatient services that increases the likelihood that someone will successfully follow up with outpatient services once they've interacted with crisis services. And then, of course, critically, CCBHC also defines the funding that makes all of these services sustainable. And so for Sandra Eskenazi Mental Health Center specifically, CCBHC has allowed us to hire 19 professionals that are available 24/7 to respond to 988 calls anywhere in Marion County. Across the state, there are 19 mobile crisis teams and 21 different crisis receiving and stabilization services. So CCBHC is the only mechanism that we have to sustainably support mobile crisis and the full spectrum of services needed that ongoingly both follow up and also prevent mental health crises. And so I want to share an example of a coordinated system approach across our services that was made possible by CCBHC. So this is an illustration of how this works in practice. So our crisis team was recently consulted to assess an individual who had visited the emergency department 5 times over the past 2 months related to anxiety. A crisis clinician saw that this person was unlinked to mental health services. And after discussing Sandra Eskenazi Mental Health Center services with that person, the crisis clinician was able to provide a mental health intake assessment at that point of emergency contact and then set up the first appointment with a CCBHC outpatient program prior to discharge from the crisis services. Unfortunately, the client actually missed that first appointment, though. However, a peer recovery navigator recognized that that appointment had been missed and was able to provide outreach to the client. The navigator was unable to reach the client and so reached out to the Sandra Eskenazi Mental Health Center mobile crisis team to complete a wellness check. And when the mobile crisis team arrived, they found that the patient was actually having a panic attack that arose when they realized that they had missed their first appointment. And so then with the support of the mobile crisis team on site, she was able to get connected to the clinic actually the next day. And that included being connected to a CCBHC acute care liaison who would be able to support her during transition to the clinic to help make sure that there were no other barriers or gaps in services. And so with that support, the client was able to start care in clinic the next day. And so this highlights the level of care coordination across multiple teams and locations and services that is made possible through CCBHC and increases the likelihood that people are going to actually engage with the services that we have to provide. And so again, it's critical that the crisis system is not complete without linkage to those robust outpatient services through CCBHC. And so without CCBHC, mental health crisis services are like a bridge to nowhere. But crisis services with CCBHC are a doorway to ongoing treatment that ultimately helps prevent crises.
Wow, I love that analogy as far as the bridge and the door. And thank you for being that in Marion County and connecting that with crisis and CCBHC. We hear that often, right, in our local communities and some state and federal. Well, what if we just had crisis? Well, if we just had crisis, then we're not being able to be that door to connect people such as Denisha to help the sheriff not have to continue to make the same calls, right? It's really connecting all of those pieces for ongoing treatment and services. So other community partnerships that we've seen that I wanted Katie at Southwestern to highlight down in her area to help in kind of wrapping up the partnership component before we move on to the next part of our panel discussion. Katie, could you share about that?
Yeah, so I want to talk just about a few unique things. There's the obvious partnerships that we've talked about, but one thing I didn't want to miss is these unexpected partnerships. An example of that is our public library. Public libraries are where a lot of individuals go that are experiencing mental illness, and they are now calling us if they're concerned about one of the individuals at the library. And so we've developed a relationship with them to where we provide training to their staff there. They call us if they're concerned about somebody, and we come. There's other small businesses throughout our community who now know to call us if there's just someone in their business or someone near their business that they're concerned about. And before, they didn't know who to call. They didn't know what to do. They just knew that there was something wrong. So having access to that in all parts of our community has really been impactful, I believe. But the other thing I wanted to mention is something that's very unique about CCBHC is the ability to engage in what's called a designated care organization partnership. It's a DCO. And Southwestern has done that with 2 organizations. And what it allows us to do is adapt to the unique needs of our community. All of our communities have different resources, and we don't want to duplicate something that's already here. So one big part of CCBHC, as we've heard, is hiring peers to provide peer services, that lived experience. And Southwestern does have peers that provide that service. However, there's an organization in town called the Peace Zone. And the Peace Zone is a peer-run, peer-led organization that's all that they do, and they can do it at a volume and a level that we just can't. And why would we do that when it's already here? And so what CCBHC allows us to do is to have this formal partnership with them where they provide the services and we bill it and we pay them for their cost. So it's financially sustainable for them so that they can survive, but it's also helping us because it's able to provide care for our clients at a rate that we wouldn't be able to do ourselves. Another agency that we have as a designated care organization is Easter Seals Rehabilitation Center. So our Easter Seals in town, they have a large psychology program. They partner with a local university. They have a training and fellowship program for future psychologists. So they have this robust program. And we need psychological testing for our neurodevelopmental center. Why would I hire a psychiatrist or a psychologist to do testing when down the street I have this great program training future psychologists? So we have a DCO agreement with Easter Seals, where again, this person provides services in our clinic, provides the services that our clients need. We bill CCBHC, and we pay for the cost to Easter Seals. So the uniqueness of that model, I think, is really important to note because it allows us to use our current community resources rather than duplicating what we already have.
You, Katie. And I know in the chat there was a question around IDD, and I know you've done a lot of great work in that space. Is there anything in particular that you would like to highlight that is done with your center that you did along with CCBHC?
Yeah, so the Neurodevelopmental Center started as a grant because there really wasn't good integrated care for individuals that have both a mental health concern as well as intellectual or developmental disability. And so this partnership with Easter Seals has allowed us to have a multidisciplinary team to care for these very complex individuals all in one roof with one treatment team. And so it's been wonderful for families so that they don't have to travel to Riley. They don't have to leave our community. They can get the care that they need here. And we have a building that we're renovating that will open soon, and we'll be excited to share that with our community. But the unique thing about CCBHC is how we get paid, right? And so it's our cost with the amount of services that we provide. So this is a costly service to provide this level of specialty care for these very complex individuals. And so we're able to get paid a rate that will pay for our cost. We're not making money. We're not making profits here. It's just paying for the cost of caring for these individuals, which also, frankly, is saving Indiana money because we're able to provide the care in the community rather than having expensive ER visits or hospitalizations or residential stays.
Wonderful. Thank you for expanding on that. Another thing that I noted in the chat was around the veteran services and an individual that is part of the care response for Veteran Affairs. And so I just wanted to call that to the demo sites to make sure that you have that connection, because CCBHC does have the veterans and military as a focus. And so wanted to make sure you guys saw that. So as we wrap up our panel discussion, and I think the attendees here have heard from each of our demo sites the impact that they have been able to see through the great work that they have done this past year, I wanted our panelists to, and this is going to be hard for some, but I know we can do it, in one sentence, explain your biggest success or impact that you have seen this past year. Art, I'm going to start with you at Hamilton Center. One sentence, my friend.
All right. We have community collaboration that empowers our consumers from crisis to care. That's CCBHC.
Wonderful. Thank you, Art. And Kelly at Oakland up north, your one sentence that you have seen as your biggest success and impact.
Yeah. With Art, it's got to be our increased partnerships and community involvement through the work of CIT and crisis services that has had a rippling effect, allowing us to impact more lives and giving us a broad platform to teach and advocate for our clients.
Wonderful. And Rob, your one sentence to explain the biggest success and impact.
We've been able to hire more staff, improve employee retention, provide better training, strengthen no wrong door approach to crisis, launched 24/7 mobile crisis, improved coordination of care, and engaged in more community outreach.
Wonderful. And Stacy at Radiant, your one sentence of success and impact.
It would be saving lives by providing quality care weekends, evenings, and weekends, so people get the right support, right time, and right setting.
Wonderful. And Katie at Southwestern, your one sentence of impact and success.
CCBHC gives us access to the right care that our unique community needs when they need it.
Wonderful. Dr. Overly.
Yes. So as a psychiatrist, I recognize that CCBHC allows us to provide the services that I know should be the standard of care that will allow us to reduce the cost and harm associated with untreated mental illness and achieve the triple aim in healthcare. So providing affordable, high quality care that improves the mental health of Hoosiers.
Wonderful. And our other psychiatrist on the call, Dr. Christine at Adult and Child, your one sentence.
Yeah, thanks, Zoe. Like Dr. Overly, I'm going to come at this from a bit of a personal perspective. So what I would say is, as both the president of a CCBHC and a practicing physician within our organization, I have witnessed firsthand with the people that I serve how the CCBHC model drives meaningful improvement in client and patient success by providing comprehensive, coordinated, whole person, sustainable care, and allows clinicians like myself to focus on treatment and high quality outcomes rather than barriers to access and gaps in community supports.
Wonderful. And our last but not least panelist, Dr. Carrie Cadwell, your one sentence of success and impact.
We are all familiar with the federal and state rural health transformation program. I will simply say CCBHC is rural health transformation.
Wonderful. Thank you, Dr. Cadwell. And Sheriff and Denisha, we did not rehearse one sentence, but was there one sentence or one thing on your hearts and minds regarding the impact that you have seen that you would like to share with all those on the webinar?
I can go first. I think CCBHC means rehabilitation, not incarceration.
Wonderful. Thank you. What a sentence. Denisha, anything you would like to say to our attendees?
Yeah, I just think that CCBHC again will help and not hurt.
Wonderful. Thank you so much for sharing that. Thank you to our panelists. Thank you. If we could take a moment recognize the work that they have all done. And like I said, it is all over the state of Indiana. It's lives like we've shared with you today. Thank you again to our sheriff. I'm going to now move to our call to advocacy. So can everyone see that okay? Our call to advocacy? Okay, wonderful. So what you've heard today is why advocacy matters. At the national and state level, we must expand CCBHC, establish Medicare and Medicaid CCBHC benefit, and continue investing in both CCBHC and our crisis systems. At the state level, we must continue to integrate 988 crisis stabilization and CCBHC services, as you heard from Dr. Overly about why they need to be together. And at a local level, like stories from the sheriff and Denisha today, we need to have every provider, every client, every sheriff share the stories to help in fueling change. And that call to advocacy starts with you. And we are so grateful that everybody was able to join. I did want to share that there is federal legislation moving. This is from the National Council for Mental Wellbeing. It is the Assuring Excellence in Mental Health Act of 25. It is the continuation of all of this work that we have shared with you today. The bill will establish CCBHCs under Medicare and Medicaid. It will also authorize other grant language. It will create further opportunities to integrate both physical and behavioral health, and it will further enhance strong accountability measures. You heard that from Senator Kreider earlier and from some of our demo sites today, the data and the measures of the success. So the link will be in the chat and in these slides for you to reach out to your members and Congress for support today. And so we wanted to share that federal bill with all of you and also the state advocacy. So in closing, besides the thanks that I want to offer to the demos and to the sheriff and to Denisha for being on and Senator Kreider, I also wanted to thank the Indiana Council staff. You've seen two black squares on the screen that have not come on, but because they have been instrumental and helped to make this webinar possible. That is Leanne Jordan and Nancy Henry, as well as the Indiana Council team. We could not be where we are today without the team at the Indiana Council. So CCBHCs, they are not a pilot. They are not just a demo or an experiment. They are a long-term sustainable transition and a proven solution that is federally defined, state-driven, and locally achieved. You have seen today on this call that leadership and partnership for advocacy. I'm going to now open it up for Q&A to see if there is anything that people wanted to ask. You can put it in the Q&A section. I did also see in the chat, and we answered some of those. There was a question about a report on CCBHC and crisis. You can find those reports on our website. We've done a return on investment, both in jails and hospitals, that is on our website. And then the National Council has a phenomenal nationwide impact of the impact of CCBHCs that I think is also on our website or on theirs. So those two reports would be the reports that I would go with. And then one question for our panelists, while others are entering questions, is have you found that you're able to pay your therapists and employees more? Is that one of the ways you've been able to keep employees and reduce turnover?
So we do mind,
Yes.
do you mind if,
Yeah, go ahead.
so I'm off video because I'm driving now, but what I wanted to say is I think the driver of the success we have had with therapists is twofold in CCBHC. The answer is 100% yes. You can pay therapists what they should be made, what they should be making, right? What the professional degree demands and for the work that they do. So that is a big part of that recruitment. However, you're just competitive with local hospitals, FQHCs, right? So it's not like you're outpacing every part of the market in behavioral health. What is the game changer, in my opinion, on the retention piece is that CCBHC is a system that is designed exactly what every therapist wanted, right? Like when we went to school, I'm a psychologist. We had an idea about what it is we wanted to do, how we wanted to practice. And the systems that exist today are not built with that in mind. And this is built with the idea that, people want teams they work in. They want to have care coordination time. They want to understand that they, are able to provide the care that they seek to provide, that they're providing best practices. And so I really truly believe that it's not just about what you pay. It's really fundamentally about the infrastructure of how care is provided that is a driving force of retention.
Great, wonderful. Thank you, Dr. Cadwell. Any of our other panelists want to weigh in on that question? I'm going to take the next question. So the next question is, what is the forecast for when the CCBHCs will be in all counties and parts of the state? That is a great question. And that is why this federal policy is so important to continue to move forward. It's on the Senate side, and we are working to get House to pick it up. We need to have federally this bill as a permanent model. As you know, it is as a demo, right? And so that's why I was saying earlier, now the next step after we've seen this year of success is to move that transformationally, not only in Indiana, but also nationwide, east to west, north to south. So those that we are so passionate in serving can get the service, whether they're in Indiana or any other state. So the forecast for us, it depends on this federal policy, and we continue to have that work done in the state of Indiana. We hope to have more counties added here this next year and ongoing. But until we know that federal answer to sustainability, that's really what we need to answer for that forecast. And then the next question for our panelists is, what do you see as technology's role in enhancing and expanding on the CCBHC model? Would anyone like to take that one?
I can take a shot. I think there are a lot of potential roles for technology. I think, quite honestly, part of the first year and building up to that was just working through and modifying workflows, clinician workflows, and documentation supports, utilizing AI supports for documentation to try to streamline those things. So I think, initially, I think part of it was just trying to accommodate the change and put those things into place. But then looking at technology as ways to improve that efficiency and connections and care and communication tools, et cetera. So I think there's a lot more to come with that as we go through the project.
Wonderful. Thank you, Rob, for answering. Anyone else want to weigh in on that about technology?
I'll just mention, Zoe, that a lot of effort is happening statewide in trying to have some integration with electronic records so that the records speak to each other, so that we can have coordinated care, being able to see what happened in the emergency room last night. And so a big part of CCBHC is making sure we have that interoperability with health records so that we can provide, care timely and accurately. The other part that I know that all of the demo sites have done is, when we have open access, you have so many people to see people at this location. And if you have more than that you have therapists, well, you can grab the therapist to the next county and you can do it by Zoom. And so I think just the ability to do telehealth has really helped with access.
Okay, wonderful. Thank you. So those have been the questions that I have received in the Q&A. And then there was one more in the chat regarding brick and mortar in Lake County. There are 2 community mental health centers in Lake County, that is Edgewater Health and Regional Health Systems. Those are our brick and mortar that are ready to be able to be part of CCBHC and the demonstration. So those would be the two I would reach out in Lake County. Any other questions from our audience? I'm going to give it another minute because, believe it or not, panel, we actually went early instead of longer like we thought we might. So,
Zoe, can I just say one thing, if you don't
course
mind?
you can. Absolutely.
Thank you. Just going back to that question around expansion, and I've just been kind of thinking through this as this webinar has gone on, and I think what you'll see here, I hope it came through that the CCBHC sites, we work really closely together. We work really well together. We learned from each other. And I think I can speak for everyone here that our only goal, right, is to make sure that every Hoosier has the care that they need and deserve when they need it. And really the only way to do that is to expand CCBHC across the entire state.
Agree. I couldn't agree more with that. Thank you for sharing that. So I have not seen any other questions come up. Were there any other final thoughts like Dr. Christine shared that the panelists want to share before we wrap up with our advocacy slide? Art, you always got something.
Well, the thing I was just thinking, it's the stories and just the data that you're hearing here. I think as more and more people, because it's one thing just to have the stories, but more as time keeps going along, I'm believing that, the data that we're seeing is the data is just as powerful. And so when you combine both of those, I think that's a very important way to look at CCBHC. It has the stories, and it also over time is going to have the data to show that this is the direction that we need to continue to go.
And I would take that even one step further to say not only is it the stories and the client impact and the data, but it's also the fiscal stewardship, both from a provider standpoint, a state standpoint, and a federal standpoint, right? It is being good stewards of being able to deliver high quality care, right? And so I think I would take that one step forward. So anything else before we wrap up, panel?
Well, I guess since we got a little time, I will
absolutely let's do it. Yes.
And since we're talking about cost, I always do like to remind people that the 2022 Indiana Behavioral Health Commission report shared with us that we spend $4 billion per year on the costs associated with untreated mental illness, which is equal to the amount of corn we generate in this state, which should be very troubling for all of us. And so sometimes people look at the CCBHC price tag and they say, oh, yikes, that's more expensive than CMHC. But you know what? It's very expensive not to do CMHC. And so I think I hope collectively that we can say, you know what, it really shouldn't be an option for us to go back to CMHC. I think that would be a real step backward for us. And at some point, we'll have to take that step to say, no, we're not going to continue spending on emergency and crisis. We're going to shift that into something that we know is long-term, going to help everyone feel better and actually improve mental health in a more sustainable long-term way. So I do think it's an exciting time to be in mental health. It truly is, I think, historically a major transformation in our country's history. And so I think it's exciting to be a part of it. And Zoe, I want to thank you for putting this together. So thank you for bringing us together, and thank you for allowing us to share these experiences. So
absolutely, thank you. I couldn't do it without all of you, and so that was a perfect way to share this one more time for all of you. This is the Ensuring Excellence in Mental Health Act of 2025. The bill summary is listed there, and the call to reach out to your members of Congress to support the bill. The Indiana Council will be hosting a couple of events to advocate for CCBHC. If you have not registered already February 17th is our State Hill Day. We would love to have every legislator have members from the local community to be able to share that local impact that I shared with you is so important. And then after the State Day, towards the end of February, we will be connecting with our federal legislators via Zoom to advocate for this federal bill. So if you've not had a chance to register for our federal State Day, or to get this fancy scarf, you can go onto our website and look at our political action that you could be able to donate to. So please go onto our website. We can put that in there. And if there's not, I see one more question popped up. Let me see here. Yes. The question around IDD, about connecting persons around how they've seen those with autism and dual diagnosis navigating the services. Katie, you responded with interest. Are there any other thoughts from the group on this, since it's such a huge need and one to share regularly? Are there any other members on the panel that would like to share about that? I think Katie has really led in that area. So Tiffany, we will have Katie reach out. And then if there's anything else related, we'll make sure to get that to you. And then the other question I will answer: what milestones need to be met to expand the CCBHC model? So there are milestones that have been set around access to care and improvements of access to care. But right now, what we are really advocating for is the cost sustainability beyond the demonstration. So that's why this federal policy is so important, because that is our sustainable plan. And so that is really the measure that we need to get to in order to be able to add folks. So I appreciate that question. So Leanne has put in our website link regarding membership and also the State Day. So you can see that there. And we actually have wrapped up 15 minutes early, which I did not think would happen. So again, I want to thank our panelists and all those who joined us today. Remember, we are more, CCBHC is more than this demo. It can be transformational. We are that proven solution, and we look forward to the continued leadership, partnership, and advocacy to be able to do that for those that we serve. Thank you so much, and we look forward to connecting with you on February 17th. Take care, everyone.